The image that you're seeing, this is what we call it as the Hickmans line. Hickmans line is what? Central line. But central line which is not coming directly, right? You can have a direct access. If you talk about it in terms of central access, I can go like this, which is a direct access into the subclavian vein, or I can bury this under the skin. So if this is the candle, I'm burying this under the skin, and from there it goes into the subclavian vein, and this is what we call it as a tunnel central line. The other name for tunnel central line is going to be your exam question, is what called as the Hickmans line. Remember, Hickmans line is nothing but a tunnel central line. What is the advantage for these central lines? They are going to be very comfortable, because when you put a jugular access through here, subclavian veins are better when compared to jugular because they stick in an anti-dependent position. They're very discomforting. The patient can't move his neck. Every time he moves, the line moves. The line movement will cause increased chances of line dislodgement, line sepsis, wound sepsis. Everything is common or more prone in your jugular access. Subclavian vein is much more better. Now the question is, image shown is true except it is used for long-term parenteral nutrition, correct, known as tunnel central line, correct, reduces the risk of line dislodgement and line sepsis, correct. Can it? Chest x-ray is not required to confirm. Remember, I'm not doing chest x-ray to confirm. I'm doing it to document that I've put the line. That is the first important reason. The second important reason, yes, to look for position as well, right? When you talk about the central lines, remember, in emergency, if they ask you in emergency which is the most commonly put central line, it is your internal jugular vein. But if the question is what is the best central line, then it is your subclavian vein. Please do not goof up with this. Most common, best, most common, which is going to be easily available, accessible, and I can get it right away, that is the jugular, because zup, you're gone into the jugular. Subclavian requires a little bit of skill, so for that to do, you require time. I don't have resources and time in emergency, so I'll not put subclavian. Otherwise, subclavian is considered to be best.